well-being and the well-being of the nation as well. Thank you too, sister. Happy New Year to you too. All right.
As the crowd grew and the ambience much more intense, we stumbled upon an Indian family visiting the Gambia for the first time, and they're enjoying the joys of a new year. To them, New Year's Eve celebrations here will be something they look forward to because of their first experience.
Happy New Year, how are you?
I'm fine, thank you. How do you feel about the day?
Oh, very nice.
Very nice.
Very nice.
Are you having fun?
Yes, I'm happy. Yeah, I'm very happy.
What country are you from?
I'm from India.
Happy New Year. I'm first time in Gambia.
2013, I just want to live in Gambia forever now. Wow. I love this country very much.
Is
It
cool.
is a beautiful place.
Good and cool Gambia. Hey, great. Happy New Year.
Happy New Year.
Proverbial sentiments re-echoed by the people included prayers for peace and stability to prevail in the country, good health and long life for Gambians. For GRTS News, I am Aji Amisise.
The Minister of Health and Social Welfare, Honorable Balagaba Jahumpa, accompanied by a high-powered delegation, recently began the second leg of his tour to public health facilities within rural Gambia. Babakar Kamara reports the exercise seeks to acquaint Minister Jahumpa with existing realities on the ground for improved provision of primary health care services to Gambians.
He was given a hero's welcome for his actions have traveled far and wide, despite his years of absence due to earlier redeployment in the foreign service. He is known as Action Man not by virtue of his personality and loyalty to President Jammeh, but his ardent concern to the development of the Smiling Coast as a true patriot working round the clock.
Some of these issues are basic necessities for the health center. It should not wait for the ministry or for the president. Really, it's at the management level of these health centers and for the hospitals, because we feel that the Ministry of Health and Social Welfare is not an office work, it's a field work, and most of it needs action, action, action.
He have earlier renewed his allegiance to the Gambian leader and embarked on the second leg of his nationwide tour, engaging 13 health facilities covering the 118,000 population of the North Bank region, sparsely inhabited within 163 villages. He started from Esau to Medina Serigne, where a community clinic on the rehabilitation is predominantly financed by their homeborn Dr. Njoguba. He worked round the clock and retired after a painstaking exercise lasting for 22 hours, visiting Kerkerno, Kuntea and the AFPRC General Hospital in Farafenye, reaffirming gains underscored by the Jammeh administration.
Some of the health centers we visited, I noticed that, where the patients are, on the beds, there are no pillows. Some of them were even trying to struggle to take their bags and use it as pillows. So I felt that these are basic necessities of any health center that they should provide to our people. And hence directives were given on the spot to get some pillows. And as we go, as you can see, we bought a lot of pillows, and as we go, the same thing in many health centers, we distribute them. What I have also observed in these health centers, apart from pillows, is that you have family and friends who come into the health centers to visit their patients, and they don't have anywhere to sit. Instead, they sit on the beds. That is also not acceptable.
We have, seen what he has done, and I have no doubt, because he's called an action man. Immediately on the spot, he was able to solve most of our problems. One, we need refurbishment of the hospital. The hospital since 1999 has not been refurbished. He promised that GAMWorks would be here as soon as possible, I think next week, to assess all the refurbishment requirements of the hospital.
His findings on the high incidence of malaria cases were not surprising for a man who values the opinion of every individual and looks beyond the capacity of an ordinary eye. He sounded their opinion as auxiliary staff, patient and community leaders, with a view of incorporating their concern in his new cabinet portfolio as health minister. His talk continues. Babakar Kamara, GRTS.
That's nice. The network on gender-based violence over the weekend ended a 2-day sensitization on gender and HIV and AIDS at the National Nutrition Agency. Fatoumata Simaha reports on the program, which brought together stakeholders to discuss gender and HIV and AIDS with emphasis on its eradication.
On gender-based violence is a Finnish initiative aimed at combating violence against women and girls in the Gambia. It is also a platform which seeks to bring together NGOs and public institutions involved in women empowerment, as well as provide coordination and discussion of gender issues in the country. The Deputy Director, Social Welfare, Falu Sow, reiterated that gender-based violence is a serious issue which needs collaboration and partnership. He called for better coordination and communications between stakeholders and service providers to ensure that gender-based violence is eradicated. The Director, National AIDS Secretariat, NAS, Usman Baji, described gender-based violence as a serious public health and human rights problems such as HIV and AIDS, domestic violence of women and girls, and several harmful traditional practices which reflects and reinforce inequalities.
Health policies and programs often focus on the biological aspects of treatment, prevention, and diagnosis of HIV and AIDS. So now the world has come to realize that besides the biological aspect of diagnosis, treatment, and prevention, there is another very important dimension to HIV and AIDS, and that is the social factors, of course including gender-related issues.
The country officer, UNAIDS, Mr. Noah Cisse, who highlighted the crucial role his institution plays in the fight against gender-based violence, also gave an overview of research on harmful reproductive and sexual health practices women encounter in some instances, resulting in untimely deaths.
As for young women, research conducted in many parts of the world concluded that young women may be particularly more vulnerable to HIV infection for a variety of reasons. Among them are the fact that young women have immature cervix with a thinner mucous membrane which secretes lesser amounts of protectants against viral penetration.
Noah revealed that the gap remains very big in gender equalities, and various types of gender-based violence and HIV and AIDS are apparent within the context of achieving the Millennium Development Goals. This ongoing training makes it possible for local players to develop and implement good practices to address gender-based violence issues. For GRTS News, I am Fatoumata Simaha.
Fatoumata Simaha there, and time now to take our first break. When we come back, we'll take a look at news from outside Gambia.
At Zenith Bank, every day is a celebration. We celebrate you, our customers, for taking every stride with us all through the year. Zenith Bank, the biggest bank in West Africa, your ideal banking partner, offering the most innovative and technologically driven products and catering for all your financial needs. With a wide range of banking products including our reliable money transfer platforms, RIA, Western Union and Money Express, that ensures your money is securely sent and received. Our e-products guarantee you a world-class banking experience with products like XPath, real-time access, WebPay, and our reliable alerts and internet banking. We pride ourselves in people, technology, and service. We are here to serve you and share in your success story. Merry Christmas and a Happy New Year from Zenith Bank, a truly Gambian partner.
Welcome back to the news. More than 60 people have been killed in a stampede in Ivory Coast on New Year's Eve. The incident occurred when people converged at the site to watch the fireworks and panic broke out. As we hear in the CFI report, the cause of the panic is not yet certain, but the tragedy was turned into a blame game between the public and the security.
In Abidjan in Côte d'Ivoire, near the Félix Houphouët-Boigny Stadium, shoes, clothes, and bloodstains remained scattered on the ground after people were crushed in a stampede. Around 1 o'clock in the morning, after a fireworks display for the new year, a crowd panicked when they were going home. Ivorian television showed images of the mayhem. At least 60 people were killed when they were crushed and suffocated in the rush of people, including many children. Dozens of others were injured.
There are some wounded people that left on their own and others who refused to be evacuated. on n'est pas sur les lieux du feu d'artifice.